Welcome back to another edition of TCM Graduate TV. I'm Kenton Sevcik, registered acupuncturist. This episode 101, and we are continuing on with my heavy hitters that I use in the clinic with Kidney 10. Now, Kidney 10 is a hussy point. And it's important to remember that hussy points affect the organ directly. So these are commonly used as regulatory acupuncture points. So for example, if you have an organ that is in excess or deficiency, you can use a hussy point safely just to tell the organ, as I affectionately always say, to get its poop in a group, just to regulate itself. Now, hussy points do that. However, some work better than others at doing certain actions, either the tonifying action or the reduction action. And this is very much the case with Kidney 10. It is very good for draining damp heat, and it does so in the genital area and in the urinary area in terms of Chinese medicine. So let's look at what it can do. It is very effective for stones. Stones in the kidney, in the bladder, and in the ureter. So because it helps drain damp heat in this area, of course, it's going to also be good for such conditions as leukorrhea. It is also known to help with genital itching. I like to use this acupuncture point as almost like an alarm point. As we know, front mu alarm points can be used if an organ is in distress, and we can push on that and check to see if it's sore. Most often, if a patient has a bladder infection, kidney stone, etc., those sorts of things, I actually push on Kidney 10 to see if it's sore. We can do this, you've probably noticed this, if a patient has dampness due to spleen qi deficiency, you can push on spleen 9, and maybe even you were just palpating to find it and the patient just jumps right off the massage table. And this is very common with, again, those types of conditions, and we can push on Kidney 10 to see if it's sore. So it's a good alarm acupuncture point for those sorts of things, as well as bladder infection. Of course, I'm going to also use this acupuncture point for knee pain. No matter what I'm using this acupuncture point for in clinic, I do prefer my patient to be lying face down with their head in the headrest, because I can put a bolster or a pillow underneath their ankles. It causes a little bit of a bend in their knee. Very similarly, I don't like to needle large intestine 10, 11, or 12 with a patient's arm straight out. It's going to stretch out the tendons, the muscles, the fascia. It's not going to be very comfortable. I like to have my patient's knee bent, not only to help locate this acupuncture point, but for comfort. So there you have it. Lots of great reasons to use Kidney 10 in the clinic. It's a very powerful acupuncture point. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video.